Hello, everyone, and thank you for joining us today. My name is Carla Legrea with the National Center on Domestic Violence, Trauma, and Mental Health. Today's webinar is Creating Accessible, Culturally Responsive, and Trauma-Informed Organizations, Guidance to Support Implementation in Domestic and Sexual Violence Services. Our trainer today will be Kathy Cave, a Senior Training Consultant for NCDVTMH. Before we get started, I would like to go over some technical details of the WebEx software that we'll be using for today's webinar. Many of these details are explained on the Using this Webinar System tab on the upper left-hand side of your screen. Please be aware that your screen might look a little different depending on whether you're using a Mac or PC. On the right-hand side of the screen, there are multiple boxes. The second from the top is the chat feature. This feature will allow you to provide feedback and share resources with your fellow colleagues, as well as get in contact with the trainers or myself if you have questions regarding the training content. You may contact Angelica Medina, also with the Center, if you have questions troubleshooting the WebEx software. To do this, click on the down-facing arrow and select the person you would like to contact. You'll see a lot of options, but for this session, you'll want to select all participants if you would like to respond to a question from the trainer or to contact me anytime during the session. You should click on Angelica Medina to privately contact her if you are in need of troubleshooting the WebEx software. So let's test this chat feature. Will everyone please go to the chat box, click on all participants, type in where you're calling from, and then press enter? Perfect. Thank you all very much. While folks can get a lot out of the chat feature, there are times when it moves really quickly and can feel distracting. If this is true for you, feel free to minimize the chat box by clicking the arrow next to where it says chat. You can always open it again with the same arrow if you choose. We'll be providing live captioning during this webinar. Below the chat box, there's a media viewer box. This will contain the captions. If you don't want to see the captions, click on the down-facing arrow next to the word Media Viewer, the same way you might if you want to hide the chat box. Susan Blumenfeld, also with the Center, will be moderating the Q&A at the end, time permitting. And at the very end of the webinar, you'll be taken to a brief evaluation. Please take a moment to let us know what was useful and what could have been better. If you get disconnected at any point, return to the email you received with the original webinar link and re-enter the training. Sometimes the sound cuts out due to internet connection, so feel free to call in if there's a problem, if this is a problem for you. If you're experiencing technical difficulties and are unable to contact Angelica Medina, you may call WebEx Tech Support to resolve any issues. That phone number, which I'll post in the chat box, is 1-866-229-3239. Again, thank you all for joining us today. I will now turn the training over to Kathy.
Talking about and thinking about guidance to support implementation in domestic violence and sexual violence services. So it's implementation of how it is that we are creating accessible, culturally responsive, and trauma-informed organizations. Our webinar is supported by a grant from the Administration on Children, Youth, and Families, Family and Youth Services Bureau of the U.S. Department of Health and Human Services. The points of view in this document and in this presentation are those of the presenters and not necessarily reflective of the official positions or policies of the United States Department of Health and Human Services. And again, thank you for joining us. A little bit about the National Center and who we are and what we do for those of you who may be joining us for the first time is that the National Center on Domestic Violence, Trauma, and Mental Health is one of 4 special issue resource centers funded by the Department of Health and Human Services Administration on Children and Families, Family Violence Prevention and Services Program. Our mission is to develop and promote accessible, culturally relevant, and trauma-informed responses to domestic violence and other lifetime trauma, so that survivors and their children can access the resources that are essential to their safety and well-being. Our work is survivor-defined and rooted in the principles of social justice. And you'll hear that, in the way that we talk about our work and the way that we talk about how we implement supporting organizations to really think about holding all of these pieces. So what does it mean to be culturally responsive? What does it mean to be trauma-informed? And how do we hold all of that in light of what we know about survivors and their experience, but also what we know about the ways that each and every one of us may be impacted in the work that we do. So we provide training, consultation, and resources to domestic violence and sexual assault advocates, health and mental health and substance abuse treatment providers, legal professionals, and government officials and policymakers on improving agency and system responses to survivors. So welcome to webinar number 2 in our series. And really, again, want to welcome you to thinking about this. So how we'll talk about this is ACRTI, and you'll hear this frequently. So wanting to say that that just means that what we're talking about is sustaining accessible, culturally responsive, and trauma-informed domestic violence and sexual assault services and organizations. And the tools that we've used to create this conversation really are reflective of this entire approach that we bring. So we will make we have a document that really describes our integrated approach, and this visual really speaks to a way of holding, again, all of these pieces at once. So while we're always thinking about the impact of domestic violence and sexual violence on people, we're also thinking about how to respond in a way that acknowledges human rights and social justice components of our work. We're always thinking about the cultural and historical and community context. Being trauma-informed is a piece of the work, but it's not all of the work. So often we're reminded that, when folks will ask for and think about, oh, we want to work on being trauma-informed means holding all of these pieces and all of these perspectives at the same time as we do our work. So the additional parts of what we're going to talk about involve really being survivor-defined in our approach. So nothing happens unless survivors say, this is what I want to have happen. And we think about both physical and emotional safety. So again, our focus may be on physical safety and what we know in light of how people are impacted by violence, that emotional safety is a huge part of what is at risk. And that without attention to emotional safety, we can't think about how we support hope and resilience, and we can't honor relationship and connection as a way to make all of this work. So as we're holding open, what does it mean? Folks are using the shorthand of trauma-informed. It means that all of these pieces are present in the work that we do and in all aspects of the work that we do. So the tools that we have created or that are in creation to work on this series, one is becoming accessible, culturally responsive, and trauma-informed organizations, an organizational reflection tool. So our first webinar in this series was introducing the tool and talking about how that relates to what we think about our work, how we think about the ways that we do our work, and are there spaces for thinking about improvement as we create ACRTI organizations and really thinking through what does that mean. And what does it mean on a daily level, and what does it mean in our communities? So the tool has a wide range of resources within it to spark reflection for really thinking about how our organizations are and how we might improve them, and how we are as we're doing the work and what we might do to improve. So it's really enhancing all of the pieces of our work. The tool that is in development is becoming accessible, culturally responsive, and trauma-informed organizations a guide to support implementation in domestic violence and sexual violence services. So in light of the conversations that we've been having about how do we support and engage leaders, how do we make it work? So there are these philosophical frameworks. There's the organizational reflection tool that can guide readiness and kind of spark conversation. Then it's what happens next. How do we actually make it come alive in the work that we do in our organizations and in the ways that we interact with survivors? So in addition to the framework document that I was speaking about earlier, we have some additional tips and tools that we're in the process of creating. And just to give you a little bit of a heads up, and I'll mention this later on, is that we have created a learning collaborative. And the learning collaborative will work with a draft version that contains much of what we're going to talk about today, and provide recommendations, give us feedback, and then we're going to develop and have that out for everyone next year. So an approach to support implementation really involves some of what you see here, in that we've got strategies, we've got tools, we've got resources, we have ways of thinking about change. And then what we recognized and what we were hearing from coalitions and programs, that engaging leadership in addition to some other pieces was really important. And we needed to focus there in terms of how leaders see themselves, how leaders experience their own roles in their organizations, and also some reflections about how others see and experience leaders. So we're going to talk about leadership's role in change management today. And in addition to incorporating some of these other pieces in some brief ways, that we need to reflect on current practice. We need to think about ways to support staff as we're all doing some really hard work. We need to plan for and manage change in a very organizational, with the organization in mind, and with a process that is laid out that really incorporates how people are thinking and feeling about the change they're trying to make, and that recognizes that a change process takes time, but it's also work that happens while we're continuing to keep the doors open and doing the work we do. So we want to enhance services and then think about ways of evaluating our work. And today's focus, again, will be on engaging leadership while we're holding all of these pieces. So a quote that surfaces some things for me is, I learned to always take on things I'd never done before, and that growth and comfort do not coexist. So again, recognizing that leadership in and of itself in our organizations is challenging work, and that as leaders, to find time to take in new information, to take in information that might be uncomfortable to hear, to take in information that can be surfaced from either staff who are working in the organization or people who are using services, and really recognizing that, wait a minute, service participants have a unique position to give us feedback about how we're doing and whether or not our work lines up with our intentions. So when you're taking a step and taking a step back and a moment to look at how am I doing, and really asking that question, that those conversations can invite change, they can invite growth, they can invite a lot of positive things, but it can also be uncomfortable. And part of our conversation really needs to think about who's leading and when. So in any of our organizations, we can be thinking about, we have, a director or executive director at the top. There's, people in some leadership and management roles that may have, leadership over departments or parts of the work that we do. Board members are involved. There may be other layers of supervisory practice. There may be managers who are, focused on the implementation of a particular project. And there could be a leadership implementation team. So this will look different, and it's unique in each of our organizations. And I think the challenge is recognizing and naming that this is how we're doing it. and that that's a really transparent conversation. Sometimes we assume that because we're in these roles and because we've been working in these ways, that everyone's clear about what our process is and what the expectations are. And working in many, many, many organizations over the last, 3 decades, what I can say is that no two organizations are the same, but some of the challenges that surface are similar. And often the challenges that surface are about a lack of clarity or a lack of recognition or just not an opportunity to discuss. This is what our leadership looks like, and this is how we plan to move forward. Whether it's a more facilitative style where, a leader may want to share lots of information and lots of responsibility across the agency and invite people to actively participate and, give hard feedback and really, be open to those kinds of conversations. And other organizations have a much more different structure where decisions are made at the top. They may be made with input from other folks, but the leader holds those decisions. So in our work, I think where we often have some disconnection is that as advocates and as folks who are deeply and intensely aware of the use of power and control, when our organizational layout or makeup, doesn't feel comfortable. I think about it like as having on an itchy shirt. Then challenges arise, and sometimes we can be in organizations and in spaces where we can talk about those challenges, and sometimes not. So the ways that staff and leaders work together when challenges arise and really think about, oh, here's a challenge that's coming. Here's something that we need to problem solve together. Or here's a situation that, I didn't notice before, but right now it's bothering me and I really want to talk about it. And the ways that leaders and staff work together on those kinds of challenges really can determine whether or not it's a good time to start thinking about change or taking on a new model or enhancing the services we provide or thinking about change in big ways, because even small changes can impact people in big ways. So whether large change or small-scale change is what we're thinking about, these leadership conversations and thinking about how we lead and when we lead is critically important to the work that we do and to the success of whether or not our change works. And, again, it could be something large. It could be something related to our environment. It could be related to policy and practice. It could be related to the ways that we greet participants in our services. So any aspect of our work environments and relationships can be surfaced and looked at in terms of whether or not we need to enhance this in some way. So how open are we to those kinds of conversations is really a large question. And then there's what are we leading? That in all of the ways that we think about services and think about what we do and how we do it, and many of us are also working in organizations that are not direct service, but still have these same principles that we'd like to see show up in our work every day. And we want to live and breathe those principles in our work every day. So it's thinking about whatever that service enhancement might be or whatever the conversation is about change. It is a process that requires planning, it requires discussion, it requires management along the way. So leadership is necessary, and change leadership is what we're doing when we're managing and leading and supporting a process to change any aspect of our organizations, and that leaders are acknowledging their role to be the driver of that change. So being a driver of change looks like many different kinds of things, but minimally it means naming that change is happening, naming that there's a process, naming that leaders have an awareness of what it looks like and what they hope will happen at the end of it. So leaders have to begin with being able to communicate intentions. And sometimes that communication can involve an acknowledgement that there's a lot of things that needs to change in this moment, but we're going to start in this place, or we're going to start in a small place. Or we're going to start with readiness conversations that's recommended in the organizational reflection tool. So the ways we think about change as leaders matters a great deal because we're holding communication for the process, at least to get it started. We're holding the responsibility to clarify what we hope to see at the end. And we can invite everyone on staff to share that hope, to share that intention, but leaders' role is to clarify that, yes, I see it, and to, step out on that, declaration of this is the direction we need to go. And even if there's not a clear plan yet, the next step might be to have readiness conversations to clarify a plan. So even that conversation is important for leaders to take and to stand on that ground, and then to initiate whatever process that means. So if it means that we're going to gather together once a month, or we're going to have, a 2-day retreat or a half-day conversation, or we have an hour at staff meeting we'd like to dedicate to this, that leaders need to say, this is important, I see it, I recognize it, and I heard, maybe it was feedback from survivors, I heard that, or feedback from staff, I heard that. And because I heard that, this is the direction or this is the next step, what do you all think? So we can still be very facilitative leaders and take responsibility for initiating the process. As leaders, it's also our responsibility to consistently participate and manage the process. So again, even if our styles are more facilitative and we like to share responsibility and share actions and share, the planning, all of that is wonderful and beautiful and great. We still have responsibility that we cannot abdicate. We can't step back from our leadership responsibility because staff are sharing in the communication, for example, or because staff are willing to rotate, leadership for the meeting, that people are willing to take notes, or that folks are willing to think about together in some way. Leaders have to be part of those conversations because the responsibility sits there. And finally, I think the largest role for leaders in a very concrete way is to remove barriers that arise. So it's hard to know ahead of time what the challenges might be. So some of that gets surfaced as we have readiness conversations. We have to think about workloads. We have to think about, how much time can we devote to change in our organization and still provide all the services that we are, loving to provide, have to provide as part of our deliverables, really are passionate about how we provide them. All of those things need to happen, and yet we need to carve out some time for change. So sometimes the barriers early on are things like, how do we make sure that everyone on, throughout the organization, no matter what their work schedule is actually on the same page around this conversation of just we're thinking about a process of change. We want to hear from everyone. So one of the barriers is making sure that time and the time that people work doesn't become a barrier to change moving forward. And we have to think about that, and we have to talk about those things. And we have to talk about strategies for communication that everyone feels included. So part of our role as leaders is listening hard, listening often, really being present for the conversation that people are having in the many different ways that they might have it, and that there's many, many ways to get feedback or to have an opening for conversation. So if I don't attend a meeting because my schedule puts me in the field doing something else, how will I know that my voice is still heard as part of this change process? So those are the kinds of things that as leaders we have to continually be thinking about. And these things matter because so many change efforts can end in people feeling, oh, that didn't go where I thought it was going to go, or it didn't go as far as I wanted it to go, or that it doesn't really, what we've done is great, but it doesn't address all the challenges. So when we talk about sustainable change, we really have to think about it in terms of, are all staff involved and does everyone have a role? And part of that is around shared ownership, that it isn't just one person's role to carry everything. So the leader's role is to make sure they're aware and they're involved and that kind of they're central to all the pieces, but they don't have to do all of the pieces. Everyone can share in and take responsibility for pieces. But everyone also has to want change to happen. And that some of those, again, the readiness conversations, I know I've come back to this frequently because they're so important. We all need to be really clear about what kind of enhancement are we trying to make. So I don't know anyone who starts out saying, we want to have a change process because we want our organization to be worse. It's often around things could be better if we could, and then, filling in that blank. So having created that sense of, oh, this is really important. We all want to make change happen. We're in this together. And even those of us who might be uncertain about the outcome can still feel open to trying some small steps in the beginning of things, just to test the waters and see how it will go. So we need to be clear about what we're hoping to change. We need to be clear about having a shared message about what we're trying to do. We need to think together about this will make our organizations better in some way, and all be able to envision that. And then we need to have some knowledge about how to change. If we do these 3 things or these 5 things or this one thing, let's make sure everybody knows how to do that change rather than assume that because we talked about it, we can implement it. And then be clear about how are we going to support each other so that everyone has that knowledge and everyone can build those skills. And then to make sure we continually talk about this is what we are implementing, this is where we've seen some success, this is where a new challenge came up, what can we do about the challenge? How do we work together on that? So again, leaders have a role in holding responsibility for those conversations happening and being part of them when they do. I think as leaders, the other piece for us is how do we balance all of these pieces? So I may be incredibly aware that I'd like to make a change. I would like us to think about our intake process to be sure that we're talking about trauma in some way, letting folks know what they can expect in our services, that this can be difficult and challenging for everyone, letting people know that we are open and available and present for them when they bring their full selves. So then when I look at my organization's policies, maybe there's something that restricts that welcoming. So the vision for change might be simply, let's look at this piece of how can we be more welcoming. Is there something that we can do to offer relationship in real and meaningful ways? And leaders have to balance those conversations, right? So there's a vision for change. There's talking with everyone about how can we make welcoming better. While we're trying to make welcoming better, how do we manage all the day-to-day operations, which can include being pulled in many, many different directions? There are fiscal realities, so how does that interfere with the changes we're trying to make? Or just to, are there pressing issues that are keeping me as a leader from even being able to focus on change this week? So what we know is that when we're trying to make changes, whether it's in policy or practice, and we're trying to make change that we believe is important, that all of these other things that can happen in the day-to-day can interrupt our vision, it can interrupt our focus, it can interrupt our ability to stay on task. So it helps to have conversations about realistic planning, because realistic planning can help us manage the balance and the challenges that come in when we're trying to, again, do all of the things we're doing and still be passionate. It may be a difficult change to make. So it's how can we as leaders be both inspirational and realistic in what we're trying to accomplish and the ways that we're trying to accomplish it. And I think as we think about change management and change leadership, what surfaces to the top in every organization that I've spent time with, again, in the last 3 decades, is that people have very strong feelings about change. Sometimes we can be really, really excited about it and energized about it and hopeful, and it's a dynamic process, and we are in it, and we're all in it, and we believe in it with everything that we have. And then there may be other times where the more we talk, the more we work with staff, we start to recognize that people are feeling anxious about it. There's fear, there's worry. There can even be grief and loss experience because change is dynamic. Change means that something new is happening and that many folks are really uncomfortable with those kinds of shifts. Even when we can see and understand that it might be helpful, it may enhance our services, it may help me be a better leader, it may help advocates feel more support, it may help us serve people who are participating in our services in ways that are new and wonderful. There's still some letting go of the way that we used to do business, that even when it wasn't most effective or the most efficient or the most useful to the people that we care about deeply as we're providing services, there's a grieving of what we used to do and the confidence we felt in doing it that way. So even when there's lots of evidence or reasons why change might need to happen, there's still that letting go and fearing what might happen next, or just worry about it, or thinking about that this is going to take me so much more time, and that's probably something I hear in most organizations. Doing something new takes more time, and the reality of that is that making a shift does take time. It takes focus, it takes energy, it takes effort. So sometimes that in that time that it takes, people can start to feel doubtful, people can start to feel hopeless and really become cynical about the process of change in and of itself. So we start to question, is this necessary? Oh, you know what, this will pass. This is the flavor of the month and it'll pass. Because, 2 days from now they'll have us working on something new. So it's hard not to get lost in those feelings and those attitudes around change and to still hold on to hope that this is really going to be a good thing in the end. And that, too, is what leaders are trying to balance. So as we're considering the emotional landscape, it's really important to acknowledge that these feelings are real, that they are common, they are frequently part of the conversation when we talk about readiness, but sometimes the feelings don't get surfaced and aren't heard out loud until we're actually trying to implement change. So part of what we need to do as leaders is thinking about these kinds of conversations in this way. Let's be really clear about why are we making this change? Why now? Why is this urgent? What's created that urgency? And sometimes the answers are as simple as, someone on staff raised the issue, and when we looked at it, we thought, oh, this makes a lot of sense, or that there was a comment from a participant that really showed that there's a part of how we intend to be that doesn't line up with what people are experiencing. So let's change that. Let's look at that. That often change could be driven around funding or staffing or a shift in available funds. You know, there are all kinds of reasons why change happens, and change happens at this time and in this way. So having transparent conversations around that can help ease the buildup of resentment that can happen when we're not having those kinds of conversations. So how was it surfaced? How did people respond initially? So sometimes, you know, as a leader, I may have said, oh, I wasn't aware that that was a challenge or a barrier, so let's think about that. Let's put some time on the calendar to discuss it. So in that moment of me responding by saying, let me give that some thought, and you all give that some thought, and at our staff meeting next week, let's have a real conversation. That for the person who surfaced it in that moment, that might feel like being put off, or that your concern wasn't heard. So it's really important to just transparently say, yes, I heard you, and I want to be thoughtful about this, so let's make sure we talk about it, you know, when we're all together, and let's talk about it next week. So the ways that we respond to people's urgency or concerns as leaders will reflect whether people will feel that they're being heard. It will lead people to feel whether or not they are honestly part of the conversation, or is lip service being paid in some way where, yeah, I heard. So the way we decide whether or not something is urgent is thinking about, I think priorities for me are always, is this a service issue? Is this change that we're talking about and the conversations we're considering, you know, having and ways to even begin to have these conversations, is that will it change services, and how will it change services, and what would that change mean? Is it an organizational structural issue? So is it a byproduct of the way that our organization operates? So again, every organization has different ways of looking at leadership and naming leadership. So are we more collective and group thinking, or are we more, here's a leader, we'll get some input, and then I'll make a decision? Or is it more, we have a leadership team, we'll talk about this together, let's make sure we get input from everyone, and then we'll talk about it some more. That whatever that process is, we need to look at that and say, is that working? And is that working for everyone? If it's not working, why is it not working? And the other piece is that it could be a community issue, and by that I'm thinking things that change in our communities, in our organizational communities, but also in our communities at large, that signal that change is happening. And it could be something that's impacting everyone across the country, like the opioid crisis, or it could be something that is causing a shift in funding or a shift in priorities, both on a national level or on a state level or on a local community level. So it's looking for ways to acknowledge that these are important conversations, and that however the issue surfaces, as leaders, we're taking it seriously, that people need to know that we heard them, and that part of how we're moving forward is with a clear plan for the next step of the conversation. And I think in that and within that framework of thinking about how to hold conversations, it's important for us to stop and think, like to really press pause about who would be impacted by the change that we're talking about. So we're talking about offering more different kinds of groups in our service environment. Are we talking about offering a specific trauma treatment in our service environment? Are we talking about looking at the physical space and making changes in how things are configured? So whatever those changes are, they're impacting someone. And how are we including the ideas of the folks who are being impacted? So whether it's service participants, our staff, or leaders and other leaders or members of the community, we really need to figure that out and make sure that whatever structure we're putting in place, we're including those impacted folks as part of the conversation. So it matters when we're deciding on enhancing services, whether or not we know that sharing more information at intake would be useful or having more rules would be useful. Here's what we know. People did much better when there were less rules, once they knew there was a trustworthy space, that there's relationships that we can create on our own, that there are ways that we can work even as service participants to impact the environment that we're in. So those become collective conversations of the community as a whole when you engage people who are participants in talking about change, whether or not the change would be helpful to them, and really recognizing that just because, I had an idea doesn't mean that everyone will think it's a good idea. But it's important to be able to surface ideas and to talk about them. So pros and cons of ideas and options, and really, making that conversation meaningful. We also have to think about that since having an emotional response to change is common, and whether that we're excited or whether we're cautious or whether we are energized by it or whether we're, thinking, not so fast, or that would be great if these other things could happen first. Whatever our thoughts and feelings are related to change, it's important that as leaders, we're surfacing times where we can talk about that, and that we're creating opportunities for people to say, the change that you're talking about is or is not in line with our agency mission and vision and values. And if we're talking about an integrated approach that involves accessibility, being culturally responsive and trauma-informed, how does that line up with our current mission, vision, and values? And how do we talk about that? And again, the readiness conversations offer tips and tools for those conversations. But we really need to think about, again, how do we make it come alive? How do we make it real? And not just assume that because it's an idea that it must line up, that it already lines up. So if you're getting a sense of the theme here, communication is everything. So communication is key in terms of attending to the feelings and attitudes and thoughts that people have around change, communicating that having those feelings is natural, to be expected. It's part of how we navigate in the world. It's how we feel that, our word matters, our voices matter. And again, in the work that we do around domestic violence and sexual assault, having a voice matters deeply. So it's making sure that we're creating opportunities for that in processes of change. That when we communicate, we do it with transparency. Every idea isn't a good idea. Every idea can't be implemented for all different kinds of reasons. So let's talk about that in real ways and with compassion and recognizing that, we all have feelings, and we all have feelings about, whatever it is we're about to shift to do. So let's talk about that, acknowledge that some of us are excited and some of us not so much, and hold that. As leaders, we have to hold that and just be compassionate. Change is hard. And the best way we can support all staff in being able to navigate their own feelings about change, their own thoughts, their own attitudes, all of that, the best thing we can do is to make sure that we have a very high level of communication. So if we were already talking a lot before, we need to talk extra now. So that extra in times of change looks like, do we have, we can use technology, we can use emails, we can use all kinds of ways to make sure that everyone has an update on this is where we are in our process at this time. And that at each step of the way, making sure that we're also inviting folks to give feedback, to have solutions, to share their ideas. I might not be able to be at every meeting, but I might have some ideas for this change because I'm one of the people impacted by it. So how can we keep those kinds of conversations open? As leaders, it's our responsibility to do that in any of the ways that we have access to. And it's a matter of, again, balancing all the other things that are on our plates with this decision to move forward with change with our eyes open that it requires a shift in how we currently do business. It requires more of us. It requires more from leaders. It requires an extra minute, because sometimes that's all we have, to really think about how we communicate about the change today or in this week or as we were all together as staff. So organizations who don't meet regularly, who don't have processes in place already to communicate across shifts and different work times, it's much harder to implement a change process without doing those things first. So get the structure in place. How will we communicate, get that in place first, and then begin conversations about that. So as leaders, one of those barriers that we have to remove right away is there anything that's keeping communication from happening in the way that it needs to happen as we move forward? So it's asking that question and then addressing whatever that need might be. As leaders, we can expect that we will be attending to a variety of feelings and attitudes from the very beginning of change until all the way through implementation, and that this high level of communication can really help to avert philosophical disconnections down the road. So it's really thinking right from the beginning, again, about, yes, we have different ways of dealing with change. Yes, we have different feelings about it. Yes, we have different responses to it. And let's make sure that what we're planning to do is in line with our mission and vision and values, and that we've had a really good, strong conversation about that. Because that foundation, that philosophical foundation, keeps us together across, what I like to say is across doubt, distance, and time. So when we're doubting whether or not anything's going to happen, when we're feeling that, whoa, this is taking a really long time, or that, sometimes because of our workload, some of us may be more closely involved than others of us. So through doubt, distance, and time, it's leaders who hold the core of how are we staying in this together, making sure everyone is communicating, and making sure that the change we're talking about is in line with our beliefs and values. So this becomes the foundation to address challenges from that space rather than from feeling that we can't trust anything or we don't share a belief in anything. So creating a process for change that is sustainable requires a foundation of shared philosophy and an ability to keep moving forward with all of the different ways that we're required to communicate with one another because it's necessary. And without that essential communication, we can't do it. So Caroline Cummings has a quote, and I love this, the comfort zone is a nice place, but nothing grows there. So as leaders, not only are we setting the stage for change and which can cause discomfort that ripples through our organizations, there's a place where for each of us and our role as leaders, it's uncomfortable. So that if we try to cling to what is comfortable and what we feel is workable, it takes a long time for change to happen, and it will take us longer to engage people in the conversation. And again, that engagement in conversation is one of our earliest steps. So what are we missing, and how is it that we may be hampering our own process and hampering staff's ability to participate because it's uncomfortable for me as a leader? So things to think about are, what's my own role and responsibility as a leader? What do I see What do I feel comfortable doing? What do I feel is overwhelming? What might I feel is beyond my capacity, and do I have the support for that? So those are some of the things we'll continue to talk about as we go forward. As leaders, there are high expectations of us. So at the same time that we're trying to master new skills, we're still maybe learning what those new skills are that we need. So if change involves or invites something new in the way that we're going to think about microaggressions, for an example, and lots of folks have shared information that you're working on that as coalitions and programs, really working on conversations about microaggressions and really thinking about power and control within our organizations, and that those are, charged conversations for sure, and they're courageous conversations, but they're not easy conversations. So as leaders, we may be trying to sort that all out while we're still learning new information, and that we're then modeling all of that new learning in front of folks who are watching us very closely to see how we're demonstrating change and are we being consistent. So on some level, that staff often may have expectations that if an idea is on the table for us to make a change in our organization, that leaders will just be able to run with it. And what we can better expect is for leaders to express commitment to the value. They can express commitment to the principle, that they can agree to work on behavior or work on ways to implement change, to really stand from their own perch to see, I can see how this change that we're trying to make could ripple through the organization. And, that's leadership. And it's also leadership to say, I'm a work in progress, I'm working on that. And what we expect and what staff expect and what leaders often expect of themselves is that if there's a change in behavior, that leaders are expected to orient that change within themselves first and then to move on from that place. And that's challenging to do, again, as part of organizations trying to balance all the things we're trying to balance, and that it's expected that we as leaders will be able to do these things. We're also expected as leaders to be prepared to hold these hard conversations as part of our work and really thinking about the complexities of our work, again, from our own perch, and that it really can be very challenging for leaders to, again, balance all the things they're balancing, hold a vision for change, and still be uncertain about how will this all play out. So we all have intentions. We have a vision for what we'd like to see, but we're all, again, still a work in progress. And that when tensions arise, leaders are looked to navigate the challenge, to equalize the power imbalances, to maintain choice as part of the work that we do, and again, to do this with high skill in times of flux. So to keep moving forward when things don't feel great, that we may be weary. Leaders as change agents, we get tired, we get weary and can feel unsupported. So it's making sure that we have our own resources in place, our own supports in place to help shore us up, and that we have our own practices for refilling ourselves and refueling our soul. A friend of mine likes to say you can't drink from an empty cup, and I think that there's value in that thought. So what helps when we get in these places and we're in a bind? We may not be feeling like we have the tools and resources for ourselves to move forward. So here's some things I'm thinking about. What I would also do is invite folks to use the chat box. If you have ideas that helps leaders to really kind of keep moving forward, to keep thinking about and holding that vision for change, even when we're feeling overwhelmed by it. How do we navigate that? So I would again ask everyone to, join the conversation. I think that what I hear from leaders often is that there's different expectations, that when you're in direct service, a leader's role is to make sure that that service gets done in the most optimal ways using our best resources. When it's not direct service, it can be a little more challenging for leaders to navigate all the pieces. So it's making sure services happen, or to make sure advocacy happens, or to make sure that training and TA happen, but also the impetus to make a shift can feel a little further away because we're not doing direct service. So I might think as a leader on a project, I might think that, let's say it's a research project, I might think it's really, really important that I understand, the pieces and all the values and how that relates to other people in my organization. But I also, in the back of my mind, could think about how does that directly relate to the research I'm working on in my project? And maybe it does, maybe it doesn't. But I have this layer of other thinking to do. As a leader of an organization that, let's say, provides training and technical assistance, as we are one, part of the challenge is really thinking about, this national scope of work and balancing all the pieces of that, and also thinking about making sure that the changes we implement make sense for programs and coalitions. So as we've talked about doing implementation and working on the implementation guide, part of our reason for bringing together the Learning Collaborative is to both share all of this information, but to also hear from folks who are doing it every day, who are doing direct service every day, around these are the kinds of changes that are useful and helpful. These are the things that might create some additional barriers for services. So there's a balance to how we're holding our place in the world and how we're implementing changes. So some of the things that have helped, again, having really hard conversations early on, because they are really hard and they don't get easier later when people are feeling more pressure, maybe feeling more uncertainty about the process of change itself. So that doesn't get easier as time goes on. It gets more challenging. So getting used to this foundation of comfort with hard topics as part of change management. It also helps if staff from every layer of the organization are engaged in planning and decision-making, and that what the priority becomes for the leader is involvement. So communication in this high level that we've been talking about, that does that. That we create opportunities for frequent formal and informal communication. So there's all, what we do in meetings, and there's emails to everyone, and then there's the, someone stops by and wants to chat about it, or someone sends an email because they had an idea, and it wasn't for everyone, but they sent it to the leader. It's how, as a leader, do we make sure all of those informal conversations become part of the formal conversation. And we have to understand and recognize and look for opportunities to stretch as leaders. So one of the challenges that we have in organizations around microaggressions is that there is privilege in leadership, and the ways that we recognize that and navigate those conversations is really important. So as a leader in organizations where I've been a leader, I need to own the power and privilege that I have. And I need to be clear about what's my role, because everyone does not have the same role in an organization. So it means that I've also had to have high levels of communication, frequent staff meetings, and regular updates, particularly when we're in a process of change. And I also, recommend and have had to use, my own support systems and really think about what are my own needs as a leader and what are my resources. And if there's a gap, it's on me as a leader to fill it. I think there are some additional challenges. We've talked about this in terms of challenging and courageous conversations. So when we regularly do this, when we're really comfortable about surfacing hard topics, and working from a place of, transparency, or, this issue came up around funding, this is how it impacts us, let's have this conversation. This was something that happened in an interaction, and people were not feeling good about it, so let's surface it, let's talk about it. When we're used to having those kinds of conversations, when people and organizations are in a process of change, all of a sudden that amount of conversation can feel like, oh, wait, this is way, way, way too much. Or it could also feel for some folks that it's not enough. So it's recognizing that as part of our work and as part of change leadership, it's just knowing and naming that disconnections exist and that there's a range of feelings and attitudes and skills related to change and being able to act on whatever change is discussed. So people have different preferences, and that from person to person, the way that we experience what's happening can be very, very different. So leaders have a way of seeing themselves in their role, and staff can also experience those very same things as very different. And those discussions can be painful for people in leadership roles. So as a leader in an organization, there was a staff person who, after just being part of the organization for a few weeks, came up to me and said, so what are you doing that for? And my first reaction was, well, because this is the way we do it here. But I caught myself. I had to think about that if someone is coming in new or coming in from the outside and they're experiencing something that's a regular part of doing business as questionable, then I think it is good for us. It's good for leaders. It's good for the organization to just press pause a minute and say, someone experienced this way. Let's look at this. Let's talk about it. And is this something we should do differently? Is this something we could do differently? What are the pros and cons of doing it differently? And that as a leader, I need to be that open and flexible about it. It's much more challenging when those conversations feel personal. So if someone were to say I was not a good leader and these were the reasons why, that will feel personal. So part of it is, do I, as a leader, have my resources and supports, places where I can have these conversations, but also ways to acknowledge that I heard what was said, and I'll think about it, and we'll talk about it. And that how I will talk about it is up to me. In the same way as if I'm any person in an organization and someone wants me to change something, I need to think about what's the best way for me to do that, and can I do it? Or do I have a fundamental disagreement with that feedback, and then we still need to keep talking and then make a decision. Either we're going to keep doing things the way that we're doing them, or we're going to shift in some ways, and what those shifts will be. So again, thinking about what helps, checking in with staff during regular supervision meetings. So again, if you're not having regularly scheduled supervision or regularly scheduled team meetings or group supervision, then you're missing opportunities to check in on a regular basis. So we find that we're only checking in when things feel explosive or feel painful or feel so big they can't be taken care of in simple ways. So how do we look for small wins, small changes, small conversations to have on a regular basis, so that when the large conversation happens, again, they're based on this foundation of, yeah, we talk in real ways about these things. So in your organizations, if you're not talking about real ways and talking in real ways about how to do these things, then, again, you have a deeper dive to get everyone on the same page. It's a deeper dive to get everyone feeling connected and a part of. It's a deeper dive to keep everyone feeling as if their voice matters. And I think the only way we can do all of those pieces is to really be thinking about how candid are we being in our communication, how clear are we when things are not working, and can we keep having conversation? So sometimes people deal with confrontation by backing way up. As leaders, that doesn't help us in our organizations. So it's how do we have conversations? And again, making sure we engage everyone. And that just because we're not hearing from some folks, as I like to say, we assume that no noise is good news. People may be really struggling, and that struggle can happen all throughout the organizations. And it may happen, throughout every layer. So as leaders, we need to be able to ask for help. And that means considering our resources and thinking about, do we have ways and people that we can ask for help? And making that part of what we have to do in our own growth and learning process. So some questions for leaders about how to do some of these things. Does the leader communicate the need for change, express belief in the possibilities, clarify expectations for accountability, and demonstrate commitment? So that's a lot. There's a lot packed in there, but each piece of that is important. That if I'm saying we're going to have weekly staff meetings, then I have to say why I want to do that. The reason I think it will be helpful is that it will keep all of us in better contact around what's happening for survivors and what's happening for us in our work. The expectation is that everyone will attend weekly staff meetings. Now, if you can't because of your schedule, let's look at ways to make sure you're still part of the conversation, and let's be committed to do that. So we will be having weekly staff meetings, not just this month because we're thinking about it, but this is the plan going forward. And maybe weekly isn't realistic for my organization, so I might say every 2 weeks. And because that feels doable to me. And let's try that every 2 weeks, and then let's see how it goes. We have to, again, keep looking at our mission, vision, and values around, does this make sense? And if we're not having those conversations, that's where we need to start. Does the leader initiate and hold the process from the place of reflection, or actually even before that, to the place of someone raising a concern or a request that we can't respond to or haven't responded to, through reflection, planning, and implementation to sustainability, because that's the leader's role. Does the leader do some of these other things that are here that we would want to spend some time talking about? Like, have a really clear idea of what you expect as the leader as a result of the plan change. It's hard to communicate with folks about the process of change if you don't, as a leader, have a sense about where we're going. So it's making sure that we are holding true to this change I see looks like something, or the change that you all have requested looks like something. Let's make sure we're going to know what it looks like when we get there. And let's talk about what kind of time and energy and resources this will take, because change does not happen by itself. It does not happen without energy and effort. It doesn't happen without setting aside time to make sure that we're doing what we said we would do and we're clear about what we'd like it to be. As part of change leadership, we need to think about what are the resources that are available to us while we're in this process. So sometimes an outside facilitator might be important. Sometimes just time for us all to talk is important. Sometimes we need to have some group time together, and then maybe a smaller group of folks will work on things, but still keep communication at a very high level. And then when things break down, if there are challenges, if there are barriers that have caused for folks relationships to be damaged or stressed or stretched in some way, it's constantly thinking about when that happens, what will we do, and engaging the group in that conversation. Because sometimes, even with the best of intentions, relationship repair is needed. So better to act as if it's part of the process than something to be surprised by in the process. I want to, just doing a time check and really thinking through, highlighting some of the learning opportunities in our organizations that we need to think about. Sometimes a training up front on whatever the change you want to make. Let's say we want to change how we have rules in the shelter. We might want to have a training on the possibilities of how others have changed rules in the shelter to get everybody on the same page. And then we can talk about where do we go from here. And that we need to think about how we both engage everybody in this process and make sure that we are celebrating small successes, that we're able to problem solve, and that we're able to recognize when some of us are not comfortable with what's happening and have conversations, and anyone can press pause and say, you know what, let's talk about this a moment, and then move forward, more in a more joined together way from that place. Okay. As we move forward, leaders really need to cultivate self-awareness. And, we all have different preferences. We all have different ways that we lead and what's comfortable. Sometimes I've been in organizations where advocates and leadership have used, an inventory like the Myers-Briggs inventory, for example, to really kind of talk about and hone in on your own personal preferences or your own leadership styles. I mean, there are lots of resources out there, and I think one of our challenges is that when we're feeling pressured to make change, as leaders, we can respond from this personal place, but when you have an awareness that the request is being asked of you as a leader may just touch a tender spot in your preferences, and that lots of people have the kinds of preferences you have, and it's okay. And that sometimes it's not about what's personal, it's about that what I prefer isn't working for change management. It's not working for a leader. It's not working for this high level of communication that people need to have. So I'm someone who, believe it or not, is incredibly introverted, and yet, here's what I do, and I love these conversations where we get to talk about things. But I also like to work alone and in my head, so when people are asking me to share, can you be more transparent with that information, or can you be more clear about what you mean, my initial reaction isn't always, oh, yeah, sure, I can do that. My initial reaction is, this feels like an itchy shirt, and then I will go ahead and share what I'm doing. So we need ways to press pause and problem solve, but leaders also need to be able to get comfortable with their own knowledge, their own preferences, and to work from that place. And then to make shifts when shifts are called for. And accepting responsibility, as I said earlier, for both being consistent, being transparent, really thinking about what's happening in our organizations as we're changing. So here, I think the point to make is that in all organizations, there are groups of people who get together in different ways and connect to each other in different ways. And there are sometimes people on the outside of those relationships and sometimes people on the inside of those relationships. And as leaders, we need to be aware of those dynamics, because when people are feeling the stress of change management, they may also, gather together in those ways. So it's important that, again, everyone has all the same information at all levels of the organization, because some folks may be in that loop and some folks may be outside of it. And then to share resources that help strengthen the relationship, help focus on wellness, that actually acknowledge that we're doing something really stressful, and then move forward. So the priorities for leaders, to summarize some of these things, is to really set priorities. Again, gathering input in the ways that you do, but everything can't happen at once. So what's one change we're going to begin with and see that through? And that the first conversation around understanding an ACRTI approach is really thinking about what does it mean for me as a leader, and what am I already comfortable with? What are we already doing? What is the new learning, and how do we move forward from that place? So every leader needs to think about this question of what do I need to stop doing, to start doing, or to continue to do to be able to move my organization through this process of change. So what do I need to do as a leader to have more of a focus on wellness for my entire organization? What do I need to do as a leader to provide opportunity for everyone to share and know what is happening, to be able to make a contribution even when they can't be at every meeting? So leadership has to start within in terms of being very, very clear in their understanding that change may also change them too. So as a leader, I'll need to stop things. There are things I might need to start doing. There are things I may need to continue to do, and any of that could impact me in the way that I am comfortable doing business. So I have to press pause around what feels good in that, what feels challenging in that, and what are my supports for that. So as we talk about leadership's own support needs, some questions for us to consider. If you are let's say you're in a coalition and you're supporting leaders of programs to make some of these shifts, one of the things that would be helpful for you to understand about that particular leader is what is that leader's strength, what is their preference, what are their interests, what are the supports, and what are their resources. So that one thing is a lot of things, and that we often engage in these leadership conversations and we start in the middle with what kind of change do you want to make, and where we need to step back just a bit too is the way things are happening right now, what do you really like about it? How are your strengths in evidence? How do you prefer to lead? How do you prefer to communicate? How do you support staff? What resources do you have for cultivating your own self-awareness and for leading through change? Like, what do you imagine that would be? And then having a conversation about organizational realities. Every leader needs to be aware of those realities, and then how are people impacted. So it's having the conversation around what would stop you. If you wanted to implement this change, what would stop you? What would be a barrier? What might we consider? To have a deep exploration of the plans that a leader might have for communication, for investing in resources, for really thinking about our capacities to lead, and any upfront learning or training or beginning that's needed. You know, even before the process of reflection, that readiness conversation, again, really does support leaders thinking through some of these things, and then also hearing from where staff are about each and every one of these same concerns. Are there realistic steps for balancing everyone's workload and doing so in a way that keeps all of our work running and supports participation? And that may be a challenging question that takes a while to sort through. And if that's true, spend the time. Let's spend the time talking about how do we balance the workloads. How do we, before we jump into change, before we decide how we're going to move forward, let's figure this out so that everyone's connected, everyone's involved, no one feels left out, and we're still getting our work done. So, for example, some programs have taken this on where they meet, again, once every 2 weeks, they meet once a month on their process of change. But they may have had a consultant come in and talk about, let's say, microaggressions, or really looking at racism and oppression and the ways that it shows up in our organizations. A consultant might come in and have that conversation. You all might start in that place. and then have a couple of days of talking about it, and then start to plan together and moving forward. But that next step, planning, might take place by meeting once every 2 weeks and for, an hour and a half or so that everyone still is involved in their work and it still feels like a steady process towards change. And then asking leaders about what support do they need to explore the barriers and challenges that need to be addressed, because none of us has to do a hard job alone. So it's being open to the fact that we all need support, and what is the support? I was noticing in the chat box earlier where someone talked about having an outside organizational coach, as a leader of an organization, and many folks have really talked about that being a useful tool to make sure that your own personal leadership needs are met. And then some things that came up in the readiness tool that I won't spend too much time on, it's just, a reminder for us to really use the readiness conversation, because it guides us through how will we do this so that everyone feels included, and what are our next steps for planning, what process will we use, and how will we know that we did a good job, what kind of evaluation process would we have. So I wanted to just share with folks that there are some handouts available. We have a handout on the change management and some tips and tools for change management. We have our organizational reflection tool, and we have, there's the link to download that for anyone who did not get that in our first webinar, and then more to come. So as we talk more about leadership and implementation, we'll have additional webinars in this series, and look for ways that we can continue to grow the field and around actual implementation of whatever process it is we're trying to change, how we support leaders, how leaders support one another, and how leaders need to hold responsibilities within their organization. So seeing what's wrong and how it could be made right propels us into action. But in that action, we often leave other people behind and don't give ourselves enough time to be present or to stop and reflect. Leaders have to get comfortable with pausing in that uncomfortable gap. It's a quote from Jessica Lawrence. So as we're thinking about being leaders in the gap and supporting leaders in the gap, it's important to be able to say, I need help. It's important to be able to say, I need resources. It's important to be able to say, I'm not sure how to proceed, so that my whole staff feels included and supported as we do this. But it's also really important to recognize the emotional charge that naturally comes as part of change processes, and being willing to step in those waters too. So I'd like to pause a moment and see if there are any questions, and check in with Susan to see what we've got.
Hi, Kathy. I think I'm on mic now, too. We just had a few questions. I've been struck by how you really held us in the complexity of thinking about leadership and a leadership change process, and anticipating the challenges and looking at how to get through choppy waters and thinking about the emotional landscape as well. I'm assuming that other people have lots of thoughts going through their heads right now. Wanda commented at one point that people feel so boxed in and struggle to even, quote unquote, start the conversations. Mm-hmm. But it's something that must be gotten past. So yeah. I don't know if you have any thoughts on that you'd like to ask. Right.
Well, first of all, thank you, and I really appreciate Wanda's comment around, and it's something that must be gotten past. I mean, I think what happens is that we get very comfortable in the sea that we're in, and we get very comfortable in doing things the way we do it, and that it often takes some motivation or a nudge from someone who has either had a negative experience with us or is perplexed by why we're doing things the way we're doing it, because it's really not working. It's just we're in this groove in the way that we do it. And I think for leaders, the first step often is, to be able to have a conversation with someone outside, someone who you trust, to be able to say, I got this feedback and I'm really uncomfortable with it, and have that conversation so that when you come back and talk with staff or come back and talk with participants, it's from a place of being fully present and understanding why the person surfaced the need in the first place, and being able to move from there to consider change, or how ready are we, because until leaders have that confidence and willingness internally, it's very hard to become someone who says, okay, what can we do now? What can we do next? Because when you're in that place of fear and discomfort, you're outside of the we. And so it becomes a way of kind of wishing change would happen, but not necessarily leading the change that happens. And I think that's the fundamental difference in the way we have to approach leadership in times of change, is it can't be done from the sidelines. It has to be, leaders have to stand in the center of that.
Absolutely. And there were just a few other appreciative comments. Karen Simmons was saying that seeking out forums like this is so helpful in terms of leading and being in a leadership role, and Sandra was just commenting about how helpful this information is, and a lot to digest and think about.
Mm-hmm.
Yeah.
There was a comment that I noticed around having brown bag lunches or midweek gatherings to explore ideas and challenges. I love that idea. I love that. It brings a natural conversation to, sometimes we're talking about big changes. It's policy. We're talking practice. That people are, feeling, the change is feeling urgent for whatever reason. So let's talk about it. I love that. The informality of it is wonderful.
And Nancy, who made that comment, also talked about, at times, I'm sure this is not always possible, but keeping things light. So using humor, I would imagine, yet productive as part of being in it together in the change process.
Thank you so much for that. Yep. And I think what makes it possible to keep it light is that you're starting from a foundation of being able to trust each other and to understand each other and be compassionate for one another. So that makes a difference. It makes it possible to kind of take a deep breath and say, that was a hard thing, but we did that, and it was an uncomfortable thing, but we did that. But when the foundation is shaky or communication is really problematic, then that makes it much more difficult to stay light when people are feeling change is urgent. So thank you all for your comments.
Yes, and I think at this point, unless you have a closing remark, Kathy, I think we'll turn it back to Carla.
No, let's turn it back to Carla, and thank everyone for your time. Much appreciated that you spent this time with us.
Thank you, Kathy, for an exceptional webinar today. Thank you to Caption Colorado for providing today's captioning, and thank you, Angelica and Susan, for making the webinar run smoothly. Last but not least, thank you all for spending your time with the Center. Within the next week, we will send you all a follow-up email with a link to the recording of today's webinar, in addition to the slides and handouts reference, all of which will be available on our website. You will also receive a certificate of attendance for your time today. At the end of the webinar, you will be taken to a very brief evaluation. If you would please take a moment to let us know what was useful and what could have been better, it would be greatly appreciated. Thanks again, and we hope you have a wonderful afternoon.